So people working across palliative care and hospice care, they're not unlike other researchers. It's the same challenges. So there's a lot of people involved, but are we really working in a way that enables research? So this is kind of where a lot of us sit in terms of maybe palliative care, but in terms of hospice care and some of the other charity organisations through these Section 38 and 39s. And of course then we also have the academic sector. And then we have loads of other stakeholders, and this list isn't exhaustive here. And really what we need to do is think of a way to kind of bring all these people together, reach consensus, and start thinking of things in a more harmonised or streamlined way, because what we need is really national solutions. We don't want something that works for the HSE but doesn't work for our partners in the Section 39s or the academic institution. So that's kind of what our office in research and development in the HSE is really trying to do. And we're very much focused on that slant that we'd like things to be sort of that national solution rather than just solutions for the HSE. So we kind of want to bring people with us as much as we can on this journey. So back in 2019, we published our 10-year action plan. And again, it's available on our publications page on our website. I won't go into it in too much detail because we'll be just touching on some of these things in a little bit more detail, but it's been interesting to hear some of the conversations around the definition of health research. So we adopted a definition from the UK which can and can't be helpful to a certain degree. And the health research regulations, they went a little bit step further, and they've given us these 5 pillars of health and social care research. And I think that's another step along the journey to help us really think about maybe things in a more broader sense, and especially, when we think of maybe palliative and hospice care, we're really maybe getting into the field of maybe more the social care side of things. And I think traditionally some of the hospital-based care didn't necessarily kind of consider that as a more holistic approach. And again, it has been touched on, so I won't go into it in too much detail, but I suppose strictly speaking, the research ethics committees should only really be reviewing studies that are health and social care research. And there are other activities that look and feel like health and social care research, using very similar methodologies and analytical approaches, but really we would be looking more and more to the institutions hosting those kinds of other activities to maybe form other sort of institutional ethical oversights for those type of activities. Back in 2021, we published this framework document. We often refer to it as our RGMS document, or our RGMS framework. So it's the Research Governance, Management and Support. So up until this point, we really didn't know the direction of traffic within the health services. And these are the 6 principles that we're really working hard on delivering, and we've made many strides. So as you sort of digest those 6 principles, I really tell you why it's relevant to this particular session about making research governance easier. When you think about implementing these 6 principles, it really is about simplifying and harmonising. It's about minimising research risk. It's about making effective and efficient research approvals and oversights. It's about making access to clinical trials and other types of health and social care research more accessible for those who want to get involved. It's about collaboration, and that of course is internal to your own organisation, external, and of course that PPI element as well. It's also about training and support, very important. And it's also about transparency and accountability. And in that sense, I think building that public trust, which leads to an increased value on research and that high quality research culture across the health services. And one of the things that we're really trying to do, and I've touched on it there, is this decoupling maybe of some of the roles and responsibilities. So I think traditionally a lot has fallen on research ethics committees in terms of approvals, but really what we're working hard to do is formulate these research offices that would really take away some of those other research governance, management and support away from The research ethics committees, obviously they may have to review them from an ethical component, that's no problem, but really all those other research governance supports would be available through personnel in research offices. These are largely futuristic at the moment, it's our target operating model, but we are working hard on establishing them. And of course, we think we're just about settled in the HSE, and we've another reorg. So just in case anybody isn't familiar, we're in the process of reorganising ourselves into 6 health regions. So all the work that we're doing in our office is very much focused on being very much aligned to Sláinte Care at a policy level, but really working with the powers and right people in the health regions to operationalise our research governance management and support framework. And really the implementation plan that I mentioned here, it really puts, and very squarely puts that power and autonomy and budget, importantly, away from sort of our office and back into the research, the health regions office. So this is kind of how we're aligning ourselves to this new reorg. So one of them is the reform of the research ethics committees. So again, you'd be very surprised to know that there's some areas within the HSE that don't have research ethics committees to go to at all. CHO 6, 9 and County Leitrim randomly within the HSE don't. But under the reform plan, we will look to have at least one ethics committee in each health region where everybody can go to. So that will include the section 38s and 39s, so it would include the hospices as well. And in very much, we're not looking to take away anybody's autonomy. If there's ethics committees already operational, like maybe in some of the voluntary hospitals or indeed some of the hospices, that we would look to work with them in a very streamlined way, but that at least everybody would have one place to go. And all these committees would work to a certain standard. And as people slowly adopt these standards, it will lead to mutual recognition. So very much following the National Office for Research Ethics Committees, whereby they can provide one single approval, even for multi-site studies. That's really where we're going with the REC reform roadmap as well. All the other things are really about, streamlining processes, policies, templates, contracts, all those kind of things. So across the system, we'll have things that are easily accessible and usable, and everybody kind of knows about them, so they can literally pull them off the library shelf and use them when necessary. This is our target operating model, and just to give you an example there, I know Karen mentioned the health sciences system of academic sciences system. And we would very much hope that the new health regions would adopt that clinical or chief academic officer model, but maybe would unfold it a bit more to include the health regions more widely and not just the hospital group. You'll see I have asterisks in a couple of places there. Unfortunately, our office had successfully secured resourcing for both these research ethics committees and the research offices at health region in last year's budget, but we lost them through the recruitment freeze. And since the launch of the implementation plan, it now takes that responsibility away from our offices and puts it back on the health regions. So while we're very much there to support them and we have all the business cases ready to go, that was indeed a bit of a step backwards, unfortunately. But we did have one area of success, and that was at the Director of Research level. Those posts did get over the line, and I'm happy to report that the first Director of Research has been appointed in the Midlands, so that's the wider Limerick area and County Clare area as well. And 2 imminent positions are about to be announced, I think, in Dublin and the Midlands and in the Southwest. So at least there's some developments happening there. I know the time is against me, but these are just some examples of some of the other types of things that we're working on in terms of that harmonised, streamlined, systematised approach to things. And again, I've mentioned some of these, the DPIA, for example, or some of the clinical trial agreements, and they have been in conjunction with our academic and Section 39 and 38 partners. So again, very much meant to be that national solution and not just a HSC solution. And again, we have published our code of standards for our research ethics committees, and as more and more committees adopt that approach, we will be able to move toward single rec opinion for multi-site studies. Just want to mention this very, very briefly, but again, this is around a digital enabler. So this is going to be launched hopefully in September. And it's very similar to the, if any of you are familiar in the NHS and the HRA, they use IRIS, the Integrated Research Application System, I think. So this will be our NERMS, is what we call it. So it's the National Electronic Research Management System. So again, very much about breaking down the barriers at the point of entry for the researchers. So it'll be a single point of entry, and then the bits that need to go to the research office will go to the research office for approval, and the bits that need to go to the ethics committee go to the ethics committee. And just to say, we didn't do this by ourselves. We had many, many partners and testers and developers who have helped us across all the various different organisations. So a big, huge thank you to all of them. And again, I think time is against me for going into all of these, but I'm sure some of you have used some research management systems in the past. But I think it really does lend itself nicely that, you know, if you ever want to persuade your own institutions about maybe adopting this platform, please get in touch with us, because I think some of the benefits of it are speak for themselves. In terms of training, we have standardised packages coming downstream this year now as well, which is very exciting. And we'll have some equality, diversity and inclusion training coming in September as well. And I might just zone in on the AIIHPC piece here. It's our first actually SLA with AIIHPC, and it's aimed at developing a module aimed at PPI members of research ethics committees. But I get by that inference, it would be suitable for any members. So it's 14 modules and 15 lessons, all in all kind of 12 hours of education. So we're very excited about that, and I think the pilot for that will be September as well. So that is how to contact us, and I will just say on our page there is the last tab on our page is how to join our mailing list, and just to stay up to date with all our developments and training opportunities. That's the kind of the best way to do it. So thank you very much.